moving on, we have just a few more minutes. I would like to ask Dr. Kirsch to add her comments to this concluding session, and then I'll wrap things up. Susan, are you with us?
Yep. Can you hear me okay? Can you hear me? Yes, okay. Well, I certainly cannot espouse the comprehensive nature of what needs to happen like Dr. Pryor. I wanted to make a few comments. When I had reached out to the National Academy of Sciences to consider this opportunity along with us in VHA and as the national access lead, I really was not expecting what we got. It's been a phenomenal cadre of input, insights, and really has provoked mine, and I've gotten quite a number of messages from the staff in the Access office and out there in the field that are participating, research folks, et cetera. So this has really been fantastic and has really put us in a position to frankly, I feel like I'm reserving the right to ask anyone and all of you if we can reach out to them into the future, because I don't want it to end here. I don't want to stop that conversation. So thank you for that. And my task really is as a leader in this organization is to really come to the Monday morning and how to operationalize some of this. So I'll make a few more specific comments that Dr. Pryor made. One was really that this is a complex issue. And I think what we did here was that wait times aren't the solution. If they might be a part of a cadre of measures, they're certainly not the sole solution, and that we need to look at what might be in that portfolio. And the thing that continues to really resonate to me throughout all the presentations has really been about that patient voice, the patient experience, the patient communication. And Alexis mentioned this. We mentioned this at the roundtable event. What are all the different aspects of the patient that we need to really look at? Continuity was mentioned, communication, preference, and I think that that's really incumbent upon us to continue to explore that. And what I want to also say is that looking at process improvement and a patient-centered approach, that is really an important way forward. And that while we seemingly, for many of you that are in VA and outside, are always running around answering whatever the issue is of the day, implementing Mission Act, looking to do a better job in improving capacity and efficiencies, looking at what we need to do for the pandemic. There's always something happening that pushes our attention to the here and now, following up to accountability agencies. I think it's really, truly incumbent upon me, and I take that very seriously, to have a strategy that is going to really move us forward. And that is why we do have this framework of the Strategic Access Management Initiative. It is really my responsibility, and I take that very seriously, in ensuring that we continue to look at different ways and better ways to do this work. So thank you all for continuing to push me and forward in my thinking in this area. I wanted to briefly address some tactical pieces, which include some of the telehealth and the workforce. It really is our way forward in access. Telehealth and virtual care delivery, not just video to home appointments, have worked very significantly with the telehealth office. And this is what we consider as access in the current era. It is must be our way forward, and I have been playing a role in that space and will plan to continue to do so. I completely agree with some of the comments about maintaining the appropriate staff to do so. And in the spirit of continuously improving and looking for opportunities in virtual care, in the last 8 weeks, I have taken on the responsibility of the clinical contact centers, really the front door to access the pandemic has pushed us into the space faster than we would have gone, but it is the right way to deliver care into the future. It is what we heard from outside stakeholders and outside entities delivering healthcare at the roundtable event. And it is the way that we must continue to move forward. And now I'm thinking about culturally driven contact center protocols to make sure and ensure that I'm addressing those veterans that have significant social determinants of health barriers. So those are some of my insights. And I'll turn it back over to you, Dr. Kaiser, and say thank you so much to the National Academy and to you for your willingness to chair this and to continue to help move VHA forward. I know that you'll always be committed to the work of VA, and you continue to show that as you help provide input and guide me and this office in that arena. So thank you.
Thank you for those kind comments and for your summary. One of the advantages of going last is that I can abbreviate my comments by saying I agree with the prior speakers and could leave it at that. I'm not going to quite do that, but yeah, I think there's so much that has been said that to agree with the complexity of access, the need for a multidimensional portfolio of measures. I would say that given that is one of the clear messages that has come out of not just this workshop, but the roundtable that was held earlier this year, as well as from the literature, it is now incumbent upon VA to take that forward. And instead of just accepting the status quo of wait times as a measure, I think it's incumbent upon VA to put forth what are the other measures that we should be including in that multidimensional dashboard, portfolio, cadre, whatever the right word is, to characterize how VA is going to think about and measure and be accountable for access going forward. And I think just it was alluded to earlier, but I should mention that as another part of this initiative that Dr. Kirsch has launched is the effort with the National Quality Forum that is currently going on to try to flesh out what some of those measures should be and some of the ways that there can be accountable mechanisms for tracking and measuring access going forward. I would just underscore as well the points that have been made certainly by Dr. Pryor and Dr. Kirsch here, but by many of the speakers as well. The essentiality of the patient's voice, the veteran's voice, but not just getting it, but getting it in real time and in ways that it can be operationalized quickly. As good as the department's current efforts may be in getting that voice, information 6 months after it's been solicited is really not acceptable. We need information that can be in near real time, if not real time, to design our systems. I think one of the other observations that's worth noting that the pandemic has shown that the VA can move very quickly when it needs to. It's demonstrated that in how it has shifted to virtual care and its ability to onboard thousands of new employees. So the question is now, why not keep that agility going forward? Why can't we continue to change in rapid ways as needed? I know from my experience with the organization 20 plus years ago that the VA can change quite quickly when it is incentivized and pushed in the right direction. And so I think that that's one of the other things that will come out of this workshop is certainly as a result of the pandemic is that the VA can move quickly. So why shouldn't that be the norm as opposed to the exception going forward? last thing I think, and this is a bit repetitive, but just to underscore, the reason the VA was created and the reason that it exists is to serve veterans and to meet veterans' needs. And that, again, just underscores the need and the essentiality of getting the veterans' voice into everything that we do. So I think we are about out of time. I want to thank the Academy staff for the excellent job that they have done in putting this event together. Hopefully some of the rather very substantial technical issues that confronted the Academies yesterday morning, and which they have worked very hard to deal with, and I think successfully deal with. We've not seen it, but there's been a tremendous amount of behind the scenes activity going on to make sure that technically this came off smoothly, and with a few very minor glitches, I think it has. But a few wrenches were thrown into the process night before last that weren't planned, and that has complicated things. So my thanks to Emily and Cindy and Carol and Cheryl, Evan, all the other folks who have worked to make this happen. Thank you all to the participants on the panels, to the moderators, to the planning committee. Events like this are a group process and reflect a lot of people working together around a common purpose. And I would hope that, as I said before, that while this event is concluding now, it's more a beginning of an ongoing dialogue than it is to the end of the discussion. And I'm quite confident, actually, that Dr. Kirsch is going to continue the dialogue going forward. And with that, unless the Emily or other Academy folks have any final comments, I will bring this workshop to a close. And hearing nothing, a final thank you. I wish you all stay safe and try to avoid the COVID as much as possible. All right, we are ending this workshop.